Good morning. If you have decided to study to become a professional hypnotherapist, continue with us in this beautiful project of study and learning. Hypnosis is a powerful technique with which you will be able to help and improve the quality of life of a great number of your future patients. Remember, study the description of this video where you can find a link to free clinical hypnosis training classes with several free ebooks. Plan until the moment of quitting smoking. From now and until the date you have indicated to quit smoking, we propose you these easy exercises that will be of great help during this period of preparation. Read your personal lists of reasons to quit smoking. Make several copies. Stick one on the mirror in the bathroom, one on the fridge, another one in your workplace, etc. This way, you will be able to remember the reasons you have to quit smoking. In the morning, when you wake up, in the kitchen, while having breakfast, at your workplace, in the bathroom, at night, before going to bed, etc. This will make you think about everything you will gain if you give up tobacco. On each occasion, think carefully about the meaning of each one of your motives. Make sure that they are genuinely important reasons to you. Additionally, paste this image everywhere you can, so that you can see it while you're doing any work. It is a good idea to put it in the bedroom, so that it is the first thing you see when you wake up and the last thing you see when you go to sleep. Unmasking tobacco. To begin to unmask tobacco, start by stripping it of the virtues that it does not have. You must be aware that the one who solves everyday problems, faces boredom or routine, overcomes tensions, faces frustration, overcomes tiredness, enjoys pressure, is you, and not tobacco. Tobacco is neither more nor less than a drug with psychoactive effects to which your body has adapted to be able to function normally, which does not mean that tobacco helps you to cope better with your daily problems, to relax better, or to be more alert. On the contrary, once you are free of cigarettes, you will see how you can cope better. You will see how you can cope better with the everyday situations in your life. To do this, the first step is to put tobacco in its rightful place. Smoking is not a help for you, but rather a burden. Until your body recovers the possibility of living normally without nicotine and without the automatisms to which you have become accustomed. At the beginning, it can be difficult. At the beginning, you might find it difficult to achieve your goal. For this reason, during the first days, you'll have to be very alert and change some routines. But after this first phase, more complicated, you should know that you will recover the control of your life and of your time, of your gestures, of your triumphs, and of your frustrations. You will regain control of an important part of yourself that you lost a long time ago. When you do, you will see that it is not the cigarette, but you who faces the day-to-day, but you, yourself. To regain control, to break the automatic and unconscious associations, it will help you to know that you have very valuable personal resources and that you can start using them. If you use tobacco because you have developed a strong addiction and your behavior is strongly automated, review the daily cigarette log. Start to be aware of the situations in which you are associated with tobacco use. Once you have identified these situations, think what alternative activities can help you to cope with these situations without smoking. Ask people close to you, partner, family, friends, and work colleagues, to from the day you have said to stop smoking, not to offer you cigarettes. Not to offer you cigarettes. Do not smoke in your presence or allow you to smoke. Consider the possibility of combining the plan, personalized, that we propose in this video with a pharmacological aid, effective for the purpose of quitting tobacco. Investing what you now spend on tobacco in this treatment can help you to reinforce your decision to quit smoking. If until now you have used tobacco as a stimulant, you should know that you can activate your body and your mind in another way. For example, when you want to improve your level of alertness, breathe rapidly for 30 to 40 seconds. When you can, take a short break from your daily occupations. Take the opportunity to activate your body by doing some moderate exercise. If until now you have used tobacco as a gestural reinforcement to gain security in a stressful situation, find something to hold in your hands, a pen, a keyring, your glasses, or any small object within reach that you can manipulate, or a rubber ball to squeeze. Use some simple relaxation technique, discharge anxiety with some simple exercise. Quickly walk down the hallway several times. Open the window. If you can, change place or activity. Remember a time in your life when your voice saved you from some mishap. If up to now you have used tobacco as a way of obtaining pleasure or reducing negative states, seek greater and better pleasures. Seek sensations pleasing to the taste, to the sight or smell. For example, take candy or sugar-free gum. Indulge in that perfume you always liked. Treat yourself to some flowers. Go to a masseur for a good relaxing massage, etc. Do some activity that you feel like doing. Go for a walk in the fresh air. Listen to music. Visit a good friend that you haven't seen in a while. Start that video that you've been waiting for months. Enjoy a relaxing bath with essential oils and good music. Sign up for that course that you never had time for. Identify the supports you can count on and use them. In addition to these guides, you should foresee the additional supports that can be of great help. Have them planned among the people who are close to you and assess the possibility of additional professional help. Personal supports. It is very positive that you talk about your decision to stop smoking, preferably with someone who has successfully gone through the experience of quitting. It could be a family member, a co-worker, or it could be a friend. Ask this trusted person to commit to give you the support you may need at some points in the process you are now starting. Choose someone who can listen and support you whenever you need it, even by phone, by email, or by any other means of communication. Write down the names of the people who agree to help you, who you can turn to at times when the urge to smoke seems irresistible. Just when you feel you need someone, to talk to or hang out with, look for them in family, in friends, and at work. If your addiction is high, value professional support. If the degree of addiction you present is high, consult with some health professional, psychologist, hypnotherapist, doctor. Many of these professionals can offer you more effective treatments to combat your high addiction. Additionally, you should know that there are several drugs that can help you to quit smoking. These are nicotine replacement treatments and bupropion. Before consuming any medication, always consult a professional, especially if you are pregnant or trying to become pregnant. If you're interested to continue learning about clinical hypnosis, watch our next video. Improve your environment. Remember to study the description of this video, where you can find a link to free training classes about clinical hypnosis, with several ebooks also free of charge. If you have questions, ask them in the comments area about this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, don't miss our next videos. Thank you very much.